Welcome and thank you to joining us for another edition of To Your Health here at GBMC Facebook Live. I am your host, John Lazaru. You know, this week we're focusing on the nursing profession. This is Nurses Week. And what's really great, the nursing profession over the last several years has changed, right? But the one thing that has remained the same is the ability for nurses to give great patient care. And that really happens at GBMC and within the GBMC HealthCare system. But to talk about the nursing profession, how it's changed, if you're interested in the nursing profession, what are some of the requirements that you need before you get started? Joining us today is Dr. Joanna Nuuanu, who is the Chief Nursing Officer and Senior Vice President of Patient Care Services at the GBMC HealthCare system. Dr. Nuuanu, I hope you're comfortable.
I'm very comfortable. Thank you for having me.
Oh, thank you for coming. So we got a lot to get to, so why don't we get rolling, right? Okay, so we talked about nursing profession. We all understand how important the nursing profession is to the healthcare industry, but in your words, what can you tell me about the importance of nursing, healthcare, and inpatient care?
Well, you know, nursing is a very diverse profession. We are seen in the inpatient arena, which is the hospital base, outpatient ambulatory in the offices, home care, in the academics, research. We create evidence-based practice. So nursing today is very different from what it was years ago. We're about preventative medicine. We use our research to help guide patient outcomes, education. So you can see a nurse in the inpatient taking care of a patient on the floor who needs minor in terms of health outcomes to all the way up to the ICU, to the ORs. So nursing is incredibly diverse today, and there's multiple opportunities that they have that can impact patient care.
You know, I just want you to outline some of the first things that pop into your mind on this question. Can you give us a brief description for today's nurse and how, or the nursing profession, how it is different than, let's say, even 5, 10, 20 years ago?
Well, it's constantly evolving, so that's a great question. If you were to say 20 years ago, what would a nurse do? A nurse would carry out the orders of a physician, which we still do today by our providers and physicians and advanced practitioners. But nursing is involved in the discussion early on today. It's very multidisciplinary. We look at patient and family-centered care, and we do it with our colleagues, whether it's our physicians, whether it's social work, whether it's respiratory, pharmacy. It is very multidisciplinary, and we create the care plans necessary to move forward to get the patient back to their normal state of health.
You know, we talked before the program about how many people are involved in a certain industry or profession, and all of a sudden they say, I want to change. And a lot of them decide that they want to become nurses or follow in the nursing profession. So what are some of the educational requirements that are needed to become a nurse?
So, you know, there's the traditional way. You graduate high school, you're interested in nursing, you can go to a four-year university where you can obtain a Bachelor of Science in Nursing. You can also go to a community college, which is an AA degree that will bridge you to a university that you will end up with a Bachelor of Science in Nursing. There's also people who are going back for second careers who have a bachelor's in something else, and they can all of a sudden get their RN straight to Master of Science in Nursing. So there's various programs out there, whether you go through the bachelor's or the master's, or even if you want to start with an AA degree and bridge it to a bachelor's.
You know, prior to our program, again, you know, you and I had a pretty good discussion about nursing, but there are really, when you break the nursing profession down, for the most part, there are two types of nurses, right? There's a registered nurse, and then there's also a nurse practitioner. Can you tell me what are the differences between the two?
Right. So a registered nurse is someone who carries out the orders that is needed for a patient. A nurse practitioner is an advanced practice nurse who has their master's in nursing, and they choose a specialty, whether it's acute care, which means they're functioning in a hospital in an inpatient setting, or an advanced nurse practitioner in family care or adult or pediatrics, and they can take care of patients in the outpatient setting. They also can go on and get their doctorate in nursing of practice, which is a DNP, or they can get a PhD if they want to continue research. But an advanced practitioner can be an independent provider who can diagnose, treat, and also write prescriptions for patients.
So let's switch our conversation now to more of a GBMC healthcare system focus. How many nurses work within the GBMC healthcare
There's
system?
about 1,400.
Well, that's a lot. Yeah, that's great. Can you briefly discuss some of the great things that our nursing administrators are doing and educators and their ability to really recruit young nurses and train and mentor them, which makes GBMC a great organization to be a nurse?
So we are very committed to attracting talent from various places and different places in their lives. So historically, GBMC was a type of organization that had a lot of experienced nurses. In the last 4 years, though, we have made a significant change in trying to recruit new grads to come to GBMC. We are the only Maryland hospital in our region that has a certified nurse residency program. And what that means, if you come as a new grad, we put you through a nursing residency program for an entire year that gives you the training, the education, all of the expectations of how to be fully implemented and enrolled in your first year as a nurse so that you have the support. And we recently, 3 months ago, got that designation, which is very exciting for us. So we're getting a lot of new grads who come to GBMC because we want to mentor and foster and grow their career. So we're very invested in our employees early on when they come.
Joining us today is Dr. Joanna Nuuanu, Chief Nursing Officer and Senior Vice President of Patient Care Services at the GBMC HealthCare System. I encourage our audience and those watching us on Facebook to please send in your questions. Those watching us on Facebook, you can send your questions in the comment section of our show, or you can even private message if that makes you feel better. Dr. Ioannou, back to being a nurse at GBMC, and we talked about the ability to retain nurses, experienced nurses. I want you to talk a little bit about this professional excellence model and how it helps nurses basically select their direction and improve their skills.
So our professional excellence model is a career ladder, but it's also for nurses who come in and tell us what they're interested in and how they can guide their careers or what they're really passionate about. So we have our professional excellence models as an RN1, which is a registered nurse 1, so somebody brand new coming in is assigned in that role, all the way up to an RN4, which is someone who has more experience and has done multiple things. They can either go into the administrative track, so if they want to be a nurse administrator or a director and do management. They can also go down the track of patient and quality. So if I'm interested in performance improvement or quality or safety, I can do that track, or they can also go down the education track. So if I want to be the unit-based educator on my unit, then I could be an RN 3 or 4 and focus on education and still take care of patients, but at least it gives me a guide of what I'm really interested in. And people are so diverse in what they are thinking about, what they want to do with nursing, they can pick the track that they want to go into.
So it's clear if you read the news and watch the news and just listen to the industry experts, healthcare, the stakes in healthcare are increasing, okay? But also the complex patient cases are also increasing because the age of the population is increasing as well. So my question to you, in your words, how do our nurses at GBMC meet this growing demand every day?
Well, it's going to continue to grow with our baby boomers and so forth. Nurses have the ability to impact readmissions of patients. So if you're not treated the right way from the beginning when you hit the hospital, then you have a high incidence of coming back to the hospital because things were not done appropriately. So there's a lot of focus on doing the right thing for the patient so that by the time you hit the hospital, by the time you get home or you need home care services, that nurse is going to be integral and part of providing the whole plan of what you need so that you understand what we're treating you for, what is needed, what's going to make you better, what the plan is, what your meds are, how often you need to be doing certain things. And then that transition of care and explanation is given to the either home health nurse and so forth. So they're there to reduce costs, to reduce readmissions, to help have better patient outcomes. That's what our nurses are doing every day to make sure that we keep people out of the hospital unnecessarily. So that's a huge part of it when you look at all of healthcare costs, and nursing can directly impact that.
You know, we talked about the nursing profession and nurses at GBMC and their expanding role. You know what I mean? It's not just taking care of the patients at the bedside, but also being leaders in other parts and like quality improvement. So if there's anyone that's watching us today, whether they have a loved one or even themselves, they're interested in a career in nursing at GBMC, what's the best place for them to find some information?
So they can go to gbmc.org/nursing, and we have our own page and our own division. You can see everything that we're doing in nursing at GBMC HealthCare. And if you're interested in inquiring about how to be employed at GBMC, all of that information is on our website.
You know, one of my secret obsessions is ping pong, and I like to go back and forth. So we started with the nursing industry. We talked about, being a nurse at GBMC. So let's bring it back to the nursing profession. I want to read this because there's a lot of good information in this before the question and the question itself. There was a report in 2010 by the Institute of Medicine that said regarding the future of nursing, nurses must play new and expanded roles to improve access to quality care and to lower costs. Nurses are well positioned to help meet the evolving needs of the healthcare system. So let's flash forward almost a decade later, right? In your opinion, how insightful were those statements back in 2010 and why?
Very insightful. Nurses that statement is so true because a nurse has the clinical aspect of what's going on to the patient, but also understands the business of healthcare depending on what role. So if I'm a nurse and I'm in care management, I'm going to do whatever I can to keep my patient safe, healthy, out of the hospital, provide evidence-based care, education, and prevention. So the IOM was absolutely dead on because a nurse can be utilized in any one of those arenas to make a decision on how to prevent the worst thing from happening to a patient through discussion, education, collaboration, and having a link to that patient. So a patient feels very, very safe when they know they can call their case manager and saying, you know what, I'm having these type of symptoms today. What do you think about that? And they can advise because they've already developed the relationship. So they were forward thinking back then.
I want to pull out a quote from a member from the American Nursing Association from a few years ago. And let me just read you this quote, and then I want to get your perspective from it as well. Nurses today have major roles in coordinating care for multiple providers, managing caseloads of patients with extreme care needs. And we talked about that, right? With the increase of the age of the population. And helping patients transition out of hospitals into the home or other settings. With that in mind, how are nurses today charting new paths in the emerging field like telehealth, informatics, and as scientists and leaders?
So huge opportunity with nursing informatics. You know, back in the day, we just had our chart and everybody would document, handwrite in the chart, and sometimes people couldn't read what people wrote. That was a problem. Now everything's done electronically. That's how we deliver our care. Patients have access to their information electronically, almost instantaneously. So nursing helps build what is necessary to take care of patients. So if I'm in the inpatient setting and I need to deliver certain care and I have to use the electronic medical record, our nursing informatics people are at the table with our physician colleagues and other disciplines, and we say, does this make sense how we're going to do this electronically? So that's a big push that's been happening. You'll see them everywhere. Case utilization, where they're looking at a patient's chart after discharge. Did we do everything properly? Was everything coded properly? That is another big opportunity that you see nurses. So it is fascinating when you see what tracks that nurses end up going through in terms of academics and what degrees they get is directly related of how they can use that degree and translate it to patient care and outcomes.
Joining us today is Dr. Joanna Nuuanu, Chief Nursing Officer and also Senior Vice President of Patient Care Services at the GBMC HealthCare System. Again, I encourage our audience members and those watching us on Facebook, please provide us with some questions. I'm sure Dr. Nuuanu will be more than glad to answer them. And actually, we did get a question from one of our viewers, and Zoe asks, What is the difference between an LPN and an RN?
Okay, so an LPN is a licensed practice nurse, and their education and credentials are lower than, not in terms of, they can do less as an LPN than an RN. Historically, you would see more LPNs in nursing homes and other facilities, but the majority of the LPNs have advanced to go back and get credentialed to be an RN. So you typically don't see that many LPNs in the healthcare arena.
Coming back to the GBMC and nursing, there is one question that I've always noticed in my 6 years of being at GBMC, that we've always been known in our community, and the public consensus always says how outstanding the nursing care at the bedside is at GBMC. But today our nurses, and we talked about this, have become leaders, for example, in quality improvement. Can you explain how and why that is important? How and why that they're now involved beyond just patient care, that like quality improvements and other endeavors?
Well, because they have the science to guide practice. And if you don't have an evidence-based science behind to what we do every day, then patients and others don't feel comfortable or confident of what people are doing. Everything we do, whether it's a physician, a nurse, respiratory, is all based on evidence and practice. And we help guide and build those practices and outcomes. So back, to answer your question, or even earlier when you said a nurse 20 years ago, a nurse 20 years ago would just get the orders and do them, but there wasn't science behind to say, is this the right way we should be doing things?
We had another question come in, actually a comment. Laura says that, I love being a nurse at GBMC. I appreciate the tremendous support we receive in the unique field of forensic nursing. I am proud to be a member of the GBMC family. How does that make you feel when you hear something like that from one of your own, you know?
Yes, that's wonderful.
Yeah.
You know, when I said earlier, we are really, truly invested in people's careers from the beginning. We care about our employees. We want them to continue to grow and expand their knowledge, because ultimately, when that happens, the patients benefit the most. When you have an engaged workforce and everyone is all in to do what's best for our patients and our families, that makes me very happy and proud to hear that.
Yeah. Again, joining us today is Dr. Joanna Nuuanu, Senior Vice President of Patient Care Services and Chief Nursing Officer at the GBMC HealthCare System. We have another question from our audience. Laura?
Can you hear me? Okay, there we are. So what is the employment ratio of RNs versus LPNs, and how does that affect the quality of care?
At GBMC, or just because at GBMC we only hire RNs.
Dr. Ioannou, you know, we talked about the vital roles of GBMC nurses that they have when they deliver patient care, patient-centered care, or strengthening like primary care services, which, as you know, over the years, you know, GBMC has done a tremendous amount of work in that area. Delivering more care in the community, providing smooth, coordinated patient care. How vital are the roles of nursing in those areas, in those directions?
They're incredibly vital because they're a part of the healthcare team, and we cannot function without the discipline. So we can't function without our physicians. We can't function without our advanced practitioners or our nurses. So if every part of the team member is there functioning, we're great. But if somebody's missing, you can't deliver the care.
So now I'm going to kind of bring you out a little bit. So I hope you don't mind this question. In your words, how is being a nurse within the GBMC healthcare system different than in other hospitals or healthcare systems in the region, you know, in the state, in the country?
Well, I'm a bit biased because I love GBMC and I love our nursing staff and others. I would have to say, you know, this week is probably the most energizing, fun time to be in any hospital, because Nurses Week is we just take such a time and pride and effort to recognize our nurses. Because, you know, at the end of the day, our nurses are with the patients 24/7, 24/7. So I get very excited this week because we have an event called The Art of Nursing that I'm sure we're going to talk about in a little bit. Because we're so invested in our employees and what they do every day, it comes out when people are just happy to be there, happy to provide the care. are invested, feel like they make a connection with the patient. And when patients have to come back to us, they already have established that relationship. So to me, we really, when you look at us as an organization, go out of our way to understand who our patients are and what we can do for them, not just in our hospital, but in the community. We're invested in the community. We care whether you're in primary care, whether you're in the hospital or you're at Gilchrist. So when you look at us as a system, we look at our continuum of care from birth, because a lot of babies come and are born at GBMC, whether you're in the hospital or advanced care management at Gilchrist. So I think that is what makes us very unique.
We got about 5 more minutes left in our show. And again, joining us today is Dr. Joanna Nuuanu, Chief Nursing Officer, and also Senior Vice President of Patient Care Services at GBMC HealthCare. So here's a pop. I'm just going to throw this question at you.
Sure.
Why did you become a nurse, and why did you come to GBMC?
So I became a nurse because at 9 years old, I realized my mother had cancer and was very fortunate to survive. And I was so amazed after understanding the older I got of how she survived and what kind of care I witnessed at a young age, how nurses had an impact on her life, that I just knew at 9 years old that I was going to become a nurse. Why I ended up coming to GBMC is, one, the reputation, two, the way they treat their patients and their staff. As soon as I walked in that organization, I knew instantly that that was the organization where I wanted to grow and be with the staff and so forth. There is such a magic that happens at GBMC when you come there as a patient, whether you're delivering a child or you have to go to our ICU or you're in our ED, that people actually care and want to help you. So that's why I came to GBMC.
Well, we're glad that you chose nursing as a profession, and we're really glad that you came to GBMC. A few minutes ago, you alluded to this employee-only event that we are having tomorrow night. Called The Art of Nursing, and there's that beautiful little logo.
Can I say why it's called The Art of Nursing?
Go ahead, please.
This is where I'm getting a little bossy now. The art of nursing is, the way we define it, is the art of science, knowledge, and caring. And all three of those is what a nurse needs today to practice, and that's why we call it the art of nursing.
So tell us a little bit about the event. This is the 4th year we're having it?
This is our 4th one. It's an annual event where we recognize our nurses and our techs, and multiple disciplines come. We have different awards. We have Nurse Clinician of the Year, Nurse Patient Family Center Care Award, Diversity Award, Evidence-Based Practice Research Award. So it's a time where we can come and recognize the wonderful work that our nursing and our other staff are doing. It's a wonderful event, and I also might add, we're probably the only organization that does something to this level. It's almost like the Academy Awards. I'm not exaggerating. It's like the Academy Awards.
She is not exaggerating. She's being honest.
There's about 800 people that come. So it's an amazing event. And we just, as an organization, want to say thank you for what you do every day to save patients' lives, to take care of people, take care of their families. And that's why we do it.
Okay, so now we're going to get to the best part of our program that I just started last month. So you're the second one to go through this. What we call
I
True.
hope I survive.
You're going to be fine.
Okay.
I think you survived so far. So you're going to be great. All right, so here we go. True or false? You ready?
I'm ready.
Okay, first question. Recent statistics show that there are more female nurses than male nurses. True or false?
True, but it's changing for the better. There are more men coming into the nursing profession, which is fabulous. So every year, statistically, you look, it gets higher and higher. I hope to see in my lifetime that it's 50-50 or even higher, but there are more men who are absolutely going into nursing and as a second career.
Oh, that's awesome. That's awesome. All right, so here's the other question. Nursing is mostly manual labor. Now, you said is this a trick question?
I want to say it's a trick question because it depends. So if I'm a bedside nurse and I'm taking care of somebody who cannot walk or feed, of course, that's a lot of manual labor. But I could be a nurse who's a doctoral level or educator who I am writing protocols, procedures, doing research. So that's why I think it depends on what field you're in nursing.
All right, so you're halfway there. We got 2 more questions real quick. Nurses just follow doctor's orders.
True, but it's not just follow. See, I have to correct your questions a little bit.
That's why we're here, so it's okay.
So nurses collaborate with the physician or the advanced nurse practitioner or the physician assistant about the orders. So yes, they carry out the orders, but there's a lot of discussion when orders are being, because the physicians will ask opinions and say, well, what do you think, about this disease process of what's happening? So they do follow the orders, but there's a lot of discussion.
All right, and the last and final true or false question. Nurses get their hands dirty.
Always. Whether you're writing a research grant, whether you're taking care of a patient, whether you have a patient who's laboring and their water breaks, whether there's somebody who needs a blood transfusion, I say, because as a profession we are all in, then yes, I'm going to say we always get our hands dirty for the good.
Dr. Joanna Nuuanu, Chief Nursing Officer and Senior Vice President of Patient Care Services at the GBMC HealthCare System. I can't thank you enough for coming out here today and
My
joining
pleasure.
us.
Thank you for having me, and especially during Nurses Week. And happy Nurses Week to all of our nurses across the globe. Thank you.
The conversation, oh yeah, please go ahead, applaud, it's fine. The conversation on nursing continues with the ever fabulous Mary Beth Marsden on Greater Living. She's been giving me dirty looks like, come on, Lazarus, wrap it up. I'm up next. Let's go. So before we get to that, I just want to remind everyone that next month we're going to be talking about men's health. Okay, so our show is going to air before Father's Day. So we're going to try and focus a lot on men's health next month here on To Your Health. Again, Dr. Ioannou, go ahead.
I was just going to say we have Mother's Day first, which is Sunday.
Right.
So and then Father's Day is next one. Thank you.
So she came up with a good idea that next To Your Health, maybe in May of 2020, we focus on moms and female health, which is fine. I have no problem with that. Okay, so let's see, what else? Oh yeah, before I forget, I know you said it quite well, but I also want to say it myself. For all that have taken care of my children, my wife, my parents, my in-laws, all of my immediate and extended family members, thank you to all the nurses. The doctors do their thing. Can't thank them enough, but it's the nurses that really take care of the patients once the doctor has moved on to something else. So to all the nurses out there, thank you. Again, Dr. Ioannou, Stiniyasu, cheers, and to your health.